have chosen a better theme. I don't think we could have put those three H's together any better. We have long known that housing and healthcare go together. We have known that housing is healthcare. We know that homelessness, that is not having a house or a home, is unacceptable. We also know that it is dangerous to one's health. It is deadly. It leads to illness and premature death. All of those things are incompatible with humanity. Humanity is defined as the human race, or treating people humanely, treating people well because they are humans. That is the most fundamental thing. We just heard a tremendous closing policy presentation at the rally. He began by singing a song. It says, "I belong here. I belong here." Why does he belong here? Because he is human. Why do we belong here? Because we are human beings. Why do people without homes belong here? Because they are human beings. Society may say, no, you don't belong here. This is not your country. This is not your city. This is not your park. You don't belong here. But the fact is that you belong here. We all belong here because we are all human beings. We all deserve to be treated with respect, with dignity, and the things that our founding fathers said are necessary for life, liberty, and the pursuit of happiness. We have two main problems in this country as it relates to homelessness. One is that people don't see that housing and health care are human rights. They think it is something that you don't get or you should not have in the richest country on earth that can easily provide it, when other countries that are not as wealthy or not as powerful make it available to their citizens just as a matter of human rights. We think that that should not be the case. Well, that is just wrong. It is unethical. It is immoral. It is dangerous to our society. We have a sick society because of our refusal to recognize that healthcare and housing are human rights. We have people who are sick. We have people who are dying. We have people who are paying more money than they have just so they can stay alive, when other countries say, we have the wealth, we will share it so that you have what you need. So we have a sickness of our population. And we have a moral sickness. What does it do when we as a society treat some people as less than human because of their wealth, because of the color of their skin, because of their sickness? What does that do to our soul, our society, to our culture? What does that do to our children that we are raising? This is unacceptable. Someone said we should not see this homelessness as a new normal. We should see it for what it is. It is abnormal. It is unhealthy. It is weird. It is bad. Of all the industrialized countries in the world, there is no country that has the number of people living without homes as we do. We do not have the number of people who have to choose between medicine or housing, because those things are afforded to them as human rights. On December 10th, 1948, almost 70 years ago, the United Nations and many of the nations of the world got together and passed the United Nations Declaration of Human Rights. Among them, it says that every individual has economic, social, and cultural rights, and I'm reading, including health care. Everyone has the right to a standard of living adequate for the health and well-being of himself and his family, including food, clothing, housing, and medical care, and necessary social services. Plain as day, this is what other countries recognize as human rights. Now, you have a right because you are human. Whether someone recognizes that right or not doesn't determine whether you have it. We have the right to housing and health care. And if society doesn't recognize that, then we have to make them see. We have to take what we need so that we can survive. We need to take what we need so that we can be healthy. We need to care for one another. Why? Because we are humans. The second part of that song, which Mario sang, was "See me as human. Treat me as human." And that is the second part of the problems in our country. Why many parts of our society, we can say, has a sickness. We don't recognize human rights, and we don't recognize some people as equally human. We have to condemn all of those isms that view some people as more worthy or less worthy than others. That goes against the whole nature of humanity. Dr. Martin Luther King said, we have a shared destiny, that we are bound together in the same fabric of humanity. What affects one affects all, and that is the truth. And we have to make sure that everyone recognizes the truth. I will just conclude by saying how this is abnormal and unhealthy, the current situation we have. As someone said, they are, and I am old enough to remember that though we always had poverty in this country, we did not always have mass homelessness. I remember when this was not normal or not viewed as normal. But the fact is, at the federal level, we have made a massive retreat. We made policy choices that said we will not make housing affordable for everyone who needs it. This is unacceptable. We have the wealth to do it. In 1980, we cut the HUD budget from $77 billion to $17 billion, and we have never let it rise to that level again. Is that acceptable? No. Is that good? No. Are we going to allow that to stand? No. Are we going to change that? Yes. Why? Because health care and housing are human rights. We need healthy people. We need a healthy society. And only we who see this can make others see it. We will prevail. We will not flag. We will not give up. And we will make sure that we have our fellow neighbors housed and healthy. Thank you very much.
One more time for Bobby Watts, please. One more time. So our next person is going to be Kevin Al. He's going to come up here and speak some more words. Mr. Al.
Thank you. Let's hear it for Bobby Watts. I am a poor substitute for Jim O'Connell, who could not be here today. I am an even poorer substitute for John Parvensky, who gave one of the most rousing speeches I've ever heard at a conference like this. He had to head back for a staff meeting tomorrow morning. Talk about his dedication. We are here today because we have a problem, and we are here from all over the country. Let's hear it from the West Coasters. And I'm sure we have some East Coasters. Oh, you can be louder than that. And I think we have some Midwesterners. They're very polite people here in the Midwest. My goodness, have you noticed that? There was a sign outside the hotel when we came in that there was construction going on, and it said, "Please take turns." That would not fly in Baltimore. I don't know about New York, Bobby. Never, never. Let's hear it from folks in the northern states. Let's hear it from folks in the southern states. We've got people here from all over the country, and we know we have a problem. When we did I miss any region of the country? The Third Coast. When we began doing this work in the mid-'80s, it didn't take people at Healthcare for the Homeless long to realize that we had a housing problem. The disinvestment that Bobby just mentioned happened. But everyone else in the country started trying to figure out what kind of problem we had. And we've heard all the suggestions. We've got an addiction problem. We've got a mental health problem, a deinstitutionalization problem. We've got an employment problem, right? But we knew in our heart of hearts and from our experience that we in fact had what kind of problem? Housing. What kind of problem? A housing problem. But what happened instead? Our communities set up continuums of coercion. And our communities set up housing readiness methodologies to try to go out and figure out what was wrong and what was broken with the people who found themselves on the streets. And then when we fixed them, right, when they moved from one level of instability to another level of instability, they got to a point where there wasn't any housing available for them to move into. And we all know what happened and what continues to happen. People got sicker and sicker and sicker until the United States invented an entire new definition called chronic homelessness. Because we've got a chronic homelessness problem. We say, no, we've got what kind of problem? Housing. What kind of problem? Housing. What kind of problem? Housing. Here in the state of Minnesota, it'll take you a job that pays $18 an hour to afford a modest two-bedroom apartment. $18 an hour, right. We've already heard from Bobby that we're spending about 40% on housing that's subsidized that we spent in 1979, right? So if you can't afford private market housing, and we know that many individuals and a growing number of individuals and families can't, and you can't receive subsidized housing, where are you going to go? You're going to have nowhere to go. You're going to have nowhere to go. For a long time, we have looked at our community at housing as the solution, right? We've said that if we can help someone get into housing and ended their homelessness, we have succeeded. And I'm here to tell you that I think that is flawed and wrong, and we need to shift our perspective a bit. And we need to realize that housing is actually the very foundation for health. And paradigms and philosophies have been changing, right? We've gone from a housing readiness paradigm to a housing first paradigm that is gaining prominence, right? That should be applauded. That should be celebrated. Housing is the foundation for health and not something that should be received at the end of some imaginary golden rainbow. The foundation for health. And yet we have to ask ourselves, like that woman who did the Wendy's commercials in the 1980s, right? She said, "Where's the beef?" We have to say, okay, but where's the housing? Where's the housing?
Where's the housing?
Where's the housing?
Where's the housing?
We know that there's no single healthcare intervention we can provide that isn't made better and 1,000 times more effective by rooting that care in permanent housing. And the rest of the mainstream community is finally talking about social determinants of health. Oh my goodness. But instead of rolling our eyes, instead of saying, where in the hell have you been all these years, I ask us to resist that. Instead, I think we need to work with our public health departments, and we need to work with our hospitals that are saying this, and we need to ask, where's the housing?
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 In order to solve a problem, you gotta know what kind of problem you're solving. We've got a housing problem. Let's work to solve it. Thank you.
Thank you, Kevin. Can we give him another round of applause, please? Housing is a human right. United we stand, united we fight. Housing is healthcare. That's right. So I have an opportunity every day, 5 days a week, to go out there and do the groundwork. And we are all out there doing the great work. And I get to see firsthand individuals coming out of homelessness, getting their key to their apartment, and the quality of health improves. I see it. The reason I do the work, because I see the successes and not the failures. Housing is a privilege. This is the right. This shouldn't be a privilege. Healthcare is a right, a human right. It shouldn't be a privilege. You shouldn't have high level of healthcare if you make $150,000 a year, opposed to somebody that's on a fixed income of $9,000 a year. This is a human right. Affordable housing and affordable healthcare. With that being said, I'd like to introduce this next speaker, Art Rio Sr. All right, so when I thought about doing my speech, I had changed it up. This is going to be very interactive. This is what happened to me while being homeless, while trying to get my medication for my diabetes. What it was like is I would have to run all the way across town, 22 blocks away, 22 blocks, to go get my medication in the morning at 8 o'clock a.m. Then I'd go back to my campsite, which was about 45 blocks away. And then all of a sudden, it's noontime. Now I have to go back to the clinic to go get my noon medications. This was what I had to do every day for 6 months to get my diabetes in check. Last year, I had a scare. Had a mini stroke, but I didn't say nothing. My numbers went up high, didn't say nothing. So, just this year, I've been able to challenge myself with eating a little bit better, but I still eat a lot of bread. I eat a lot of rice, but I've been able to change it up just a little bit. But understanding that someone was homeless for a little over 25 years, with an addiction of 30 years, and walking 22 to 25 blocks, back and forth, back and forth, back and forth, for 6 months, just to take care of my diabetes. My legs are all scarred up, that's why I wear a lot of long socks. But today I got SpongeBob and I got Patrick. They're tattooed on me for a reason, because I had a son that was like, Daddy, don't die. So, I did it. 6 months, over and over and over. I've battled it many, many times. So, when we do have people out there and we talk about going to encampments, and we had that conversation, and what is the resource that's needed for people in healthcare? There are people out there with diabetes. What is always fed to those folks? Cakes, pies, everything that's sugar, and it's so hard. And what's the most challenging thing to give somebody every day is a pair of socks. I do a challenge with a lot of organizations back home to see who can get the most socks. You know, change your socks every day, make sure your feet are clean, make sure your legs are clean, make sure you're sanitizing your hands when you're cleaning your feet. It was a lot of things that I had to do while being homeless. But the challenge was that I had to beat it myself. You know, I got the help of my son, but it was still, that was the things that were happening while being on the streets. Having to go to your healthcare provider for your medication every day because you did not want it to be stolen. you wanted to make sure you were taking it. To this day, I take one medication, and I only have to do it once a day. It's my metformin, and it's the best thing that's helped me. When we were talking, my A1C was about, about 11.2. Very, very high. I have just received from my doctor that my A1C has now been at 5.7 for the last 9 months. But, every time I go out of town, I end up coming back in and have to do another blood A1C test. So we're going to see what that looks like when I get back. But I really want to thank everybody. Well, understand, when we're out there doing this work, asking folks if they really need their medication, let's meet them halfway, let's meet them all the way, let's make sure they're coming to get it. Even if we have to leave and volunteer our own time to get the medication to them, let's please get it to them. Thank you.
Thank you, Art. Thank you. Can we give him another round of applause, please? What do we need? When do we want it? Now. Housing is a human right. Fight, fight, fight. So, I live in the Bay Area, California, and I get to pay 52% of my net income. That is criminal. 52%. Crazy. So this next speaker, I'd like to introduce. Her name is Sarah Lombard. Let's give her a round of applause. Thank you.
Thank you. I love you too. How you guys put me after Art, after you? Let me just tell you all. My name's Sarah Lombard. I'm from Worcester, Massachusetts, and I sit on a local cab. But I want to tell you, growing up, did I ever sit there and say, as a little girl, I want to be homeless one day? Do I want to raise my son in the street and be homeless? Nah. I never thought I would be. I grew up in a home, went to school, went to college, moved away, came back and was homeless. Had to move in with my mother. I don't know about y'all, but I'm not trying to move back with my mother. I love her to death, believe me. But once you've had your own, you don't want to go back home, But due to mental health, substance abuse, I ended up homeless in the car with my son, sleeping for a little while. But due to the fact that I knew and I was aware of some recovery programs, I was able to get into a women and children's program shelter for women and children. There I sat for 7 months. And there my son had to endure being around other children. And he was already like 10. He wasn't feeling that either. But he got really, really comfortable with some babies. So now he's a baby lover. But let me tell you, it was the hardest thing and it was the saddest thing to sit there and watch my son, who didn't ask to be here, to have to live on the street. I have to live in the shelter, but thank God that there was that shelter. And thank God for Community Health Link, because with that shelter, worked on my substance abuse. With Community Health Link, worked on my mental issues. So now, since then, I have been housed through Community Health Link for about 12 years. And I need to say it was a blessing. And it was a godsend. And I need to tell you all how nervous I was when I got up here, but you know what? This is me. You either love me or you don't. You love me today. And I see all the love. And I'm grateful. And this is my 4th conference. And I pray to God all the time that I get to go, because you should have seen me acting like a baby when they told me I couldn't come this year. I was a mess. But let me tell you, it is a right. It's not fair to our kids, that youth that are homeless nowadays is crazy. My heart pours out to them, and I go out every day and I try to help. And I do the outreach with other homeless individuals, because I remember when I was there. And it's my passion and it's my love. And a lot of people don't understand it. I just finished school for counseling, my cadence. And I need to say, I'm sitting here like, I don't want to listen to the poor me's. I want to see what's the problem. Here's some solutions. Let's keep it going. Let's help another one. Let's reach out our hand to the next one. You see somebody hungry, feed them. You see somebody without no socks, give them a pair of socks. You see somebody with no clothes and they need a change, let them. Give them something. We got plenty now, thank God. Thank God. But we got to each one teach one. And the only way they know how is if we show them how. Thank you.
Thank you, Sarah. Thank you. Can we give her another round of applause, please? What do we want? What do we need? United we stand, united we fight. Housing is health care. Fight, fight, fight! I think there should be like an ethical standard of care for affordable housing. I think there should be a law that says, you know what, we need to have this affordable housing regardless of the individual's circumstance. At this time, I want to go ahead and introduce our next speaker, and his name is, Elving Carabello. Can we give a round of applause, please?
Hello there, everyone. Hello, everybody. We're down here all the way down south, Miami. You know, when they asked me to come up here and speak, I really didn't know what to talk about. But there's a lot to talk about when it comes to Miami and the homeless population. Because what's going on is that our commissioners, our government, is building other facilities such as high-risers, and they are misplacing the homeless. They don't know what to do with the homeless population. And that has become a great, great big problem. Because since they're not being placed anywhere, they're placing themselves wherever they can fit in. And the problem with that is that most of the people that have, stable housing don't want them in their neighborhood. So now they really don't have a place to go. Why? Because they are just cleaning out the city. And the people have to go and find a place where to live or where to sleep. Really, there is no place. All the shelters are full. Right now, I'm working at the Camilo's Health Shelter down in Miami. And I can tell you that shelter is full. And most of those shelters around there are full. And we have a heavy, heavy population of homeless people. We try to do the best that we can. Okay, we try to let people in so they can shower, eat, take a nap, but they have to leave after 4 or 5 hours. It's not possible or feasible to keep that many homeless people in one shelter. Now, what we have done is, I'm actually the chairman of the Consumer Advisory Board in our clinic. What I'm trying to do is get more people involved. Get them involved in what we do in the city. We go out, we distribute blankets in the winter, which we don't hardly have a winter. We don't hardly have a winter, which is a good thing. But we do have this program. We go out, we put blankets and sheets and, sweaters and jackets, and we go around the neighborhood distributing. And you know what? We never have enough. Because the population is too large, of many homeless people. And we do try to, of course, we try to help everyone that we can. Other things that we try to do is find places where we can suggest to them. But even our suggestions are not good or proper, because the suggestions that we're sending them to, we don't own those places. So we are literally running out of places where they could go, lay their heads, find a place to shower. It's very difficult, it's very hard. But I don't think that our commissioners really understand that problem. And it is a problem that we must tackle. It's a problem that we must face and do something about it in Miami. I'm pretty sure that we have the same situations across the country. I'm pretty sure most of you go around your neighborhoods and you probably see a lot of people lying down on the sidewalks, digging in the trash cans. Well, in Miami, that's an everyday thing. You see it everywhere. And we try to give them advice. We bring them in. We send them to different shelters, but there's a little. Well, it's not little. It's a big problem because our own government officials are kicking them out of the sidewalks. You know what I mean? I mean, literally, I have a colleague around here that he took film of city officials who are supposed to be helping the homeless, kicking their properties out in the street with medications and everything. And it's like they don't care. It's like they don't care. And that's a big problem. And it's a problem that we must, fight against. It's something that we must face and do something about it. And just, don't give up on it. Don't give up on it. Don't give up on it. Because housing is health. Housing is health. We need housing. We definitely need housing. So, having said that, that's it for me, okay? Thank you for your attention.
Thank you, Alvin. Can we give him another round of applause, please? Thank you. We know why the importance of housing is that when we get individuals that are coming out of homelessness and we get them housed, they have access to a kitchen where they can cook nutritional meals. They have access to clean water. They have access to a restroom. They have access to take their medication as prescribed. What do we want? Housing! When do we want it? Now! Thank you so much for anyway, I just want to go ahead and introduce our next speaker, David Perry.
Hello, everybody. Hello. How's everybody doing? I want to talk about a very, very important topic that's happening across the nation. In particular, it's happening in my own home city. A very cruel, a very brutal campaign against the homeless, where the city of Miami is criminalizing, making criminals out of people simply because they do not have a home. But before I start, I just want to gauge the temperature of the crowd, okay? You ma'am, you have a nice sleep last night? You have a very nice sleep? Very nice bed that you went to sleep in, nice and comfortable. You woke up refreshed this morning. You ma'am, when you got up this morning, okay, you probably went to the bathroom, kind of relieve yourself, right? And you could probably you had breakfast this morning, didn't you? Yeah. And I'm sure someone else brushed their teeth, right? I'm sure you brushed your teeth this morning. Tell me something. You had that nice, comfortable sleep in a bed, comfortable bed. What if, instead of having a nice, restful, full night's sleep, all of a sudden you were awakened by a searing flashlight in your face, a kick to the side, the whoop, whoop, whoop of a police siren, okay? And an order to move on, all right? What if going to sleep was illegal, okay? And you, man, you relieved yourself in the morning. What if just trying to go behind some bushes or something like that, because you got to, all right? You have no choice. Mother Nature is calling, all right? And as soon as you do, you hear a whoop, whoop, all right? A flash, a light, and it's illegal. But you have no other choice, do you? And you want some breakfast. What if you sat down to eat, all right? You're hungry. You haven't eaten all night. But before you can take a bite, you hear that whoop, 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 all right? It's illegal for you even to eat, okay? That's what people are being faced with every single day across this nation. It is illegal to perform what's known as life-sustaining conduct. You have no choice but to sleep, no choice but to relieve yourself, no choice but to eat. And yet, these things are illegal. Okay? How does that affect your health, your mental health, your physical health? How do you think that people are going to react? Now you can understand why every single day that you spend on the streets is trauma. And it's compounded every day. Trauma compounded by more trauma. And when that police siren hits you, when they make it illegal for you to do these things that you have no other choice but to do, that simply compounds the trauma, makes it even worse. Now, I want to tell you a story. This is a real story, and it's a very, very sad story. This just happened very recently of a friend of mine. I'm not going to say her name. I'll just use her initials on the TV. It's a very, very real story. I'm working with some lawyers on issues regarding criminalness, combating criminalization of homelessness in Miami. And I had befriended a young lady who slept on the streets of Miami. Very pretty, very intelligent. She had problems, just like we all have problems. She had issues. Highly intelligent, very funny, very, very, very funny. One day when I came to see her, she said, "Hey, how was that lasagna?" I said, "How'd you know I had lasagna for lunch?" And she said, "I can always tell what you had by lunch by looking at your shirt." Okay, a very wicked, wicked sense of humor. March 27th of this year, by the way, she, unfortunately, among her issues, she had a very weak heart. She had endocarditis. Does anybody know what that is? It's an infection of the heart valve, and it makes your heart fairly weak, but it's a manageable condition. It is manageable, okay? Easily diagnosed, and it is manageable. So she was sitting on the street one day, because she slept on the streets, 8:30 in the morning. Whoop, whoop, whoop. Police came up to her. We have the body cam video. Police came up to her, stood her up, asked her for ID, turned her around, and handcuffed her. That's it, okay? She was just sitting on the street, and they arrested her. Fabricated a charge that she was obstructing a sidewalk, which is totally different than what's on the video, which is a misdemeanor. Cops during the video say, "Yeah, we know this is going to get thrown out in 2 days, but still we want you off the streets," okay? So she went to jail. They threw her in jail simply because she did not have a home, okay? This is on March 27th. March 29th, she was out. By the way, while she was getting arrested, her boyfriend was protesting the police, telling them, "Hey, please don't take her in. She'd just been hit by a car the day before." Police didn't care. They just cuffed her, pink handcuffs, by the way, and threw her into jail. When she comes out 2 days later, everything is gone. Everything. Her ID, her work clothes, her birth certificate, everything. They destroyed all of her possessions. Can you imagine somebody walks into your home and throws everything away in your home? How would you feel? Okay? So, she's already in a weakened medical state. She's now been falsely incarcerated for 3 days. She comes out and everything is gone. Okay? It continued for the next week, next 2 weeks, the next 3 weeks. The harassment continued. And this is a very real story, and we're actually pursuing this. And I'm very, 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 very sad and depressed to say that she passed away on May 2nd, 2 weeks from yesterday. She passed away, her weakened heart condition. This is a very real consequence of the criminalization of homelessness. This is not a game, folks. This is very real. People are dying on the streets. It is a very cruel, perhaps unintended, but a very cruel consequence of the criminalization of homelessness. Homelessness is an indication of the health of our society, an indication of the sickness of our society. Homelessness is a housing issue. It's a medical issue. It is not a criminal issue. It's not an issue that can be addressed through the criminal justice system. We are not going to arrest our way out of homelessness. So I would just like to leave you with the charge, the directive, the plea, the request that you go to your locality and please advocate, talk to your commissioners, Chicago aldermen, your policymakers. Tell them that there is a direct connection between criminalization of homelessness and people's lives. Tell them that people are dying on the streets, and please urge them to stop this cruel practice. Simply because you do not have a home, you are not a criminal. What do we want? Healthcare. We want it now. Thank you.
Once again, give it up for David. Thank you very much. So we actually have a duel. Two gentlemen are going to come up here and speak about the inequalities of healthcare. I have Chris O. and Mark D. from Spark. Both of you from Spark, correct? Huh? Oh, Jeff and Mark. Sorry, Jeff. Oh, wow. Look, I'm hooked on phonics today.
What a beautiful gathering this is. You all feeling energized?
Yeah!
What a beautiful conference this is too. Are you feeling energized by these couple of days together?
Yeah!
I'm feeling energized, but I'm also feeling tired. I'm mostly tired because I stayed up too late talking with my old friend Jenny Metzler last night. Checked into my hotel late. There was no room at the inn where most of you are staying, but I trekked to my hotel, slept in a beautiful bed, as David talked about, a bed that was made beautifully by caring hands, clean towels, a great shower. I woke up this morning, opened my shade, and realized I was staying right across the street from People Serving People here in Minneapolis. And it looked like great stuff was happening over there. I saw people coming and going, moving in, getting onto vans to go who knows where. And every face I saw was a black face or a brown face. Every body I saw coming and going was a black body or a brown body. I'm tired. I'm tired of us as a nation pretending like homelessness is a colorblind problem when it is not. We know that people of color are dramatically more likely than white folks to become homeless. We know that that's true for young people. We know that it's true for families. We know that it's true for single adults, for kids. We know that African Americans and Native Americans are the most at risk for homelessness in this great society of ours, and the most likely to become homeless over and over and over in their lives. There's so little margin for error in the frayed safety nets in communities of color. So many millions of people of color become homeless every year. I'm tired. I'm tired of having this conversation. I'm even more tired of not having this conversation. It's about time.
Hey team. A lot of you know me as the director of Spark and the work that Jeff and I have been doing around racial equity and homelessness over the last several years. I want to talk to you as who I was before that, and who I will be afterwards, which is a public health specialist. That's what I do. That's what I know. And oftentimes when I say that, people say to me, like, what is public health? Which is very fair, because what is public health? Public health is functionally about one thing, right? It's about what is the average life expectancy and who doesn't get that. That's all it is. It's math. And it's about understanding that people who don't get to the average life expectancy didn't get there because of choices we made. Not choices they made, choices we made. As a society, with our governance, with who we think is valuable enough to live.
So it's about time. It's about time we stop saying the system is broken, because the system is behaving exactly like it was designed to behave, which is to leave many people out, to leave many people sleeping on the streets, staying in the shelters, not knowing where they're going to get their next meal, and the majority of those people are people of color. It's about time. It's about time we started saying the word racism as a root cause of homelessness. It's about time we acknowledge the structural racism and the white supremacist policies of this country are driving high rates of homelessness among people of color. And it's about time we move beyond conversation and start taking on the issue of racial equality in our organizations, in our communities, in our society as a whole. It's about time. It's about time that each one of us, regardless of your skin color, regardless of your cultural or ethnic background, that we all start being part of this solution. It's not enough for people of color to stand up and say, I'm angry, I'm tired. The white folks have to also. It's about time the white leaders among us begin to step aside and relinquish some power so that leaders of color can emerge and be a voice at the table where decisions are made, where budgets get allocated, and where solutions get designed. It's about time. You all are amazing. You're doing amazing work. You're doing amazing work in your communities, in your organizations. You're solving homelessness one person at a time. But the reality is we can never solve homelessness one person at a time. We created this problem as a society. We've got to come together and solve it as a society.
So public health is about who gets to live. It's also about who gets a future. I've been thinking about that a lot lately. Like, what is a future? How do you get to have one? How do you know you're going there? And I've been thinking about that a lot because I get to have one, right? Like, that's why I get to think about that. I get to have one. And so it's my obligation to think about who doesn't and what I can do with mine in order to help make sure that other folks do not wind up in that space. I had the privilege of working for Governor Patrick long ago when the world was black, and it was a wild time, y'all. We did a lot of cool shit. And Governor Patrick used to always say, government is nothing more than what we agree to do together. That's all it is, right? Which is really wild, because like when you think of it that way, it means that all of government, everything we do, is just some stuff we made up today. And that we can make up anything tomorrow, right? That's what the future is. New stuff you make up. So I really want to invite us to make up some new shit. This is boring. This is a boring way to live. Like, I'm just bummed out a lot of the time, and like, I don't need to be, we don't need to be. There is a new way to be, right? And we've done this as a country so many times. I actually weirdly have a lot of faith in America, which is taboo. But I have faith in America because if I was standing here in front of you, 100 years ago, Jeff would be auctioning me off. That's not what's happening today, right? So we can do better if we decide to, and if we believe that we all have a future. Thank you.
What do we want? New shit. When do we want it? Now! Thank you. Can we give another round of applause? So the next group of people I'd like to bring up is the Minnesota Coalition on Homelessness, or for the homeless. Where you at? Oh, here they come. Here. All right, let's give her a round of applause.
Heard someone say people are not living on the street, they are dying on it. I've heard myself say over and over again that homelessness is a problem that's younger than I am. I'm 39, just turned 39, and I distinctly remember the very first time I ever saw someone standing on the sidewalk holding a sign asking for help. I could read. And what that tells me is that if it hasn't always been this way, it means that it doesn't always have to stay that way. It's not even a future that's that hard to imagine because we've actually been there before. My name is Senta. I'm the executive director of a place called the Minnesota Coalition for the Homeless, so thank you for coming to Minnesota. We welcome you. I also co-chair a campaign along with a woman named Allison Strike called the Homes for All campaign. We're a statewide coalition, a multi-sector coalition that has successfully secured $270 million in new investments in affordable housing here in Minnesota over the last 5 years. That number's about to go up when our legislature finishes their work on Sunday. But I have the opportunity to introduce you to 3 different speakers tonight who all have far more brilliant and important things to say than I do. First, Gregory Eubanks. Gregory is a local advocate here in Minnesota.
First, I want to say that you said homelessness is a problem. Homelessness is a catastrophe. When people are dying on the street, they're not only dying, they're dying of murder. I came from Nashville, Tennessee, where 19 people were murdered just because they were homeless. 19 people. Ladies were setting on fire. Ones were getting thrown in the river. Now, that is a serious humanity problem when we have that many people that hate homelessness. I think it's time for us to get in people's faces where the senators at, when it's time to say, hey, we are tired of this. From here on out, we are going, this is the year from homeless. From here on out until we eradicate homelessness. To let them know that we are here and we need to be heard. This is a nationwide problem. We need to get together all the time, every day, every single day, until we get this thing resolved. They are spending $720 million to redo a Target Center when you got to step over somebody homeless just to get in there. Say it again. It's time for this to end. All races need to get together because America is for all. Homelessness should not happen. Housing is a right. Fight, fight, fight. I wanted to go to school. I was homeless. I wanted to get to school. I had a drug problem. I got tired. I stayed in the back of behind the store and I was drinking. I said, you know what? I want to change my life. I went to a career trade college center and I had to struggle. I couldn't get homeless. I couldn't get a house no more because I got tired of being homeless and I got tired of drinking and drug, and I went to a recovery place and they told me the recovery place is 4 months long and I'm not homeless anymore. The recovery place said, well, your time's up. I'll see you later. Now that's a problem. This is a new movement going on here. We really need to get to, everything didn't start from, it starts from us. It starts small. We need to keep on going, keep on pushing. I'm willing to go as far as it takes. You might see me on the board with some representatives. Why not? We need people like this. I can tell you where the money goes. I can tell you where you're wasting money at. So I want to thank you. I want to thank you for inviting me. You see me now, but I'm sure you will see me more. And I'm willing to get here every day, every night until this problem is solved. Thank you.
Thank you so much. The next person I'm going to introduce is Representative Liz Olson. Liz is one of the people who represents the folks in Duluth, Minnesota, up by Lake Superior. And I just want to acknowledge Liz as one of Minnesota's strongest housing advocates in our House of Representatives and in the legislature generally. Liz understands that homelessness isn't a character flaw, it's a math problem. And she understands that it's the basis for everything that we need in life to succeed, for children to learn, for workers to earn, for seniors to thrive, for communities to prosper. So Liz, thank you for your championship and thanks for being here tonight.
Thank you, thank you. So I'm Representative Liz Olson. I'm in my first term in the Minnesota House of Representatives. And where I come from is listening to the voice of people who matter, because the people who lived it are the truth we need to hear and what we need to legislate based on. So your voice matters. It matters to me, and I'm going to fight like hell to make sure that everyone can feel safe, heard, and live in joy. And that is the basis. It's not enough just to thrive and get by. We want people living in joy. And we can fix this. We can do this. And I have to say, one of the most heartening things in a time of very disheartening things is the work that you all do and have done. I know you're not all from Minnesota, but in particular in Minnesota. When I left at the end of my first session last year and some really bad stuff happened, the one thing that gave me hope and heart was what we do around housing. Some of the fiercest advocates, like you heard, the fellow that just spoke, yes, and their voices are at the Capitol. They're pounding the pavement. They are strategic. They are smart. They know what they're talking about because they've lived it. And that's what matters. And so I'm so excited to see the coalition that's come together, the Homes for All Coalition, with their ask that we hear around, it's a big ask. It is not a big ask. Ask for more. We need to do more for housing. And housing is healthcare and housing tied together, and we need that for everybody. And so I am so grateful that the Homes for All Coalition, Minnesota Coalition for the Homeless, asked me to be a part of it because they do such important work, because they bring the right voices to the Capitol, and I will continue to do what I can to keep advocating, keep pushing, until we don't have to have rallies like this anymore. Thank you.
Thank you. One more Minnesota voice for you. I want to introduce you to Erica. And speaking of the right voice, she is it. Every time I've heard Erica speak publicly, there is always one thing that I take away, and I remember it for weeks or months later and think about it in my quiet moments. So listen carefully.
Come on, Erica.
All right, hi everybody, I'm Erica. Do I sound okay? I have a cold. Yeah. All right. So I am a parent in the St. Paul Promise neighborhood. I'm on their parent council, and I'm gonna tell you a little bit about my story and how I came to get here with you today. So last summer, I was working a very decent paying job, and everything was going fine until I lost the job. Now, when I lost the job, I was taking care of 6 people including myself. So my husband and 4 kids. And my landlord was so nice and so loving. He let me stay for like 3 months, and I finally said, look, I gotta go. You need to make money. So I moved out, and I didn't really have anywhere to go. I just knew I had to go. So I packed everything in my car, and I moved into my sister's basement, and my sister had Section 8. And so, we're not supposed to be there with her and her 6 kids. And my cousin has Section 8. My other cousin has Section 8. So, me and my kids, we're moving. We're going here, there, this couch, this basement, that place. Sometimes I take them to a cousin's house, and me and him sleep in the car, right? Because we don't want to get anybody else in trouble because we're in trouble, right? Because the way the system is set up, if you are getting help from the system, it's not set up for you to be able to help your family when they need it. Right? You have to turn, they want you to turn away. All right. So, during this time, I wasn't letting the school know what was going on, and my 8-year-old started missing school and being late. Actually, I had 4 kids. I have a high schooler, a sophomore. He was getting up and going on his own, so thank goodness for that. The younger 2, if I happened to be in the suburbs and needed to get them to school in the city, and my car wasn't working or the bus wasn't running, they just didn't make it, or they made it late. And when they did make it, they had to borrow uniforms from the school. Eventually, they had to tell the teacher what was going on. So, luckily in the schools, there is the Cultural and Wellness Center, which is a group of people who I love, and I ended up talking to them about it, and they told me about the Families Motivated to Succeed program, which is the housing subsidy program. They do much more than that. But, I got accepted into that program, and I met a lot of really good people. I started working with the parent council, which is a group of parents that does advocacy for homelessness and affordable housing. And, I got back on my feet. I got into a house. I was getting my kids to school on time. I didn't have to worry about that anymore. I found a way to help myself and help other people through advocacy work, through going to the Capitol along with it. So that's where I came from, and that's where I am now at this point. But I want to point out a couple more things. So one thing is that homelessness has lots of different faces, right? Yeah. So sometimes when people think about homelessness, they think about the people who they happen to see outside, who may be sleeping on a bench or maybe asking, for some assistance. But, when I was about 14. My mom was she was diagnosed with HIV, probably years before she actually told me. But when she couldn't hide anymore, when I was 14 years old, she told me. And by the time she told me, she was almost, she was very close to death. And so she passed. And, we had a meeting about where the kids would go, and nobody really knew where we would go. It was kind of like they were telling her something to make her feel better because she was leaving. But when it happened, we were kind of everywhere, between this grandma, that great grandma, this granddaddy, and I ended up with my grandfather. And when I first got there, he told me that he didn't give me a key. And then he also told me that you can't come home on the weekends. That's my time. So the first weekend, I went to 24-hour Walgreens and I walked around until I got tired of walking. And then I came back. This was in Chicago, and I just started opening doors to buildings until I found one that was open. And I stayed there and I slept there, sitting up until the sun came up. And then I found something else to do until I could go home Sunday night. Right? Now, eventually he stopped doing that because he felt bad about it. But I'm just telling you that story to let you know that homelessness has many faces. Yeah. And while somebody might not have thought that I was homeless because I went somewhere on Monday, I was homeless for the weekend. I was a 15-year-old girl standing outside. The last time I was homeless, I had a decent job. I have a securities license, I have an insurance license, but something happened. So I'm saying that to say that just because somebody is homeless doesn't mean that they are not contributing to society. Right. It doesn't mean that they are failing somewhere or just taken from somewhere. I had to go get on assistance. I had an EBT card, right? And when I went to apply for assistance, they're looking at me like, "Oh, you look like you have money." Well, okay, I had some money. I don't have it anymore. I paid taxes. I need some help. Is that a problem? Is it your job to judge me, or is it your job to help me get to a better place? Right? Thank you. And then the last thing I want to just point out is the relationship between housing and healthcare, since I see that is a theme around here. So when I was growing up in school, probably most people, you get to the science section of your schoolwork. They teach you that the three basic needs of a living thing, the three basic physical needs are what? Food, water, and shelter, right? If you don't have those three things, you cannot thrive, right? So without housing, then there's a failure to thrive, right? And people die from what? A failure to thrive. So what we want to do is, tell everybody we can, especially the people who are in power, our legislators, our policymakers, our program coordinators, that we need housing to thrive. It is not only a human right. It is a basic living need of all living things. A basic need, something that you can't live without, basically. I don't know, I got some time, but so, when we talk to them, let them know that they might not understand it, but they're killing us, right? They're taking away a basic need of ours. They are causing a failure to thrive. So when we're talking about our youth, telling our youth to stop killing each other, we need to tell our policymakers, our legislators, the people in power, stop killing each other. We are you and you are us. So we're going to say not stop killing us, but hey, stop killing each other, right? Let's come together. Let's get rid of this problem, right? Let's say we come together. We want to celebrate that this is over with, and we have something else to fight for. It's not a basic human need.
Let's give another round of applause, please. Thank you. So our next speaker is going to be Barbara DePietro and Kevin Lindemood. Oh, hi.
Hello. Hello.
Hello.
Power concedes nothing without demand. Frederick Douglass. When he said that? It was in 1857. It was 160 years ago. Power concedes nothing without demand. And what we are essentially talking about here is challenging the power structures that have kept housing and health care away from the people who need it. We need to be challenging the power structures that create racism and sexism and classism and keep people on the street and keep people away from the things that help them thrive and fulfill their potential as human beings in this country. You know what he also said in that same speech? He said, without struggle, there is no progress. This is our struggle. This is our time. This is our struggle. This is when we challenge power structures to be able to take what is ours, because power concedes nothing without demand. And we demand our human rights for housing and health care. So get out there and you march and you tell your stories like we've been talking about tonight. You tell them to the people in power. You tell them what we are going through. You tell them what we demand as our rights. We are the people of the United States. We the people. We are a community of people who matter because we belong here. Let's hear it. We belong here. We belong here. We belong here. This is our struggle. This is our time to challenge the power structures that keep this country from moving forward. Without a struggle, there is no progress. Go forward and fight, fight, fight.
So normally during our rallies at the beginning, I normally light sage, I have a little prayer, and we do a moment of silence. We're at the end. We're going to be just exactly at time. But I want to do this quick moment of silence for those still out on the street struggling. I'd just like to say thank you for coming out to today's rally for health, housing, humanity. But what I see today with everybody around today here is love, compassion, kindness, and shit. We're gonna get this shit done. Once again, I'd like to thank all of our speakers today. I'd like to also thank Paul, our other MC here. Anything to say, Paul?
No, I just want to say thank you to each and every one of you that are coming out here, that came out here to participate. I encourage you to continue to do the work in providing the best service you can provide to help help those individuals that are struggling. And again, thank you so much.
And since I'm taking on a new position, I got to put this out here. For me, I feel that this rally is dedicated to one person, Mr. Willie Mackey, as my mentor. As I change positions, my position now changes over to Paul as Regional Rep 9 and 10 as well. And he was both of our mentors. So I'm going to dedicate it for myself as this rally to him. Thank you all. Have a good evening.